Good evening, everyone. Tony Warfield here. Thank you so much for y'all coming on. As the presentation continues forward, we're going to be getting a few more people popping in. Don't even worry about that. We're just going to let them come in as they come in, and we'll be able to share the information via recording for those who might have missed some information, or those of you who might be interested in taking a look at some other presentations as well. Tonight is going to be an encore discussion. You know, the Medicare discussion from a couple of months ago was really, really powerful. Tonight's guest, Miss Ragan Adkins Small, she did a phenomenal job presenting the information. And popular demand, we thought we are going to bring her back to be able to share this information again. With some of the
Okay.
challenges that's been happening in the financial realm, particularly with this recent so-called Liberation Day and some of the other challenges that we've been facing with, discussions about Social Security, Medicare, and other support programs for our community. It's a good idea for us to have the information available so we can learn more about it. Miss Reagan, she's been in the business for almost 10 years now, and she's actually quite phenomenal. She's learned a lot of information, and she's been, instrumental in helping me to be able to disseminate this information throughout the community. There's no one that I would trust more to present this information to tonight. So I'm really hoping that if the information that she's sharing with you resonates with you, take the time to ask the questions, because this is an opportunity for you to have a licensed professional answer those questions for you to be able to help you make better decisions moving forward. So without further ado, I'm going to seriously, happily, once again introduce Miss Ragan Adkins Small for Medicare. Reagan, take it away.
Thank you, Tony. You give the best introductions. So thank you, everybody, for being here. I know that some of you are turning 65 this year, and so we've either planned or will plan to meet with each other one-on-one to talk about how you get into Medicare, what all your options are, if you need to do it based on your employment. So let me go ahead and get started. What is Medicare? So Medicare is the federal health insurance program for people 65 and older. Now, can someone who is under 65 ever get into Medicare? Yes, they can. And I'll just simply say you have to be really ill with one of two illnesses, and that's either permanent kidney failure or ALS. I won't try to say the full name of ALS, but it is also known as Lou Gehrig's disease. Lou Gehrig was a baseball player who succumbed to a very serious illness, and it's one of the illnesses that the federal government allows someone to get into if they're under the age of 65. Okay, so that's what the program is for. How do you get into it? So if you are a US citizen or a permanent resident and you have a permanent residency of 5 years or more, and you have worked for a minimum of 10 years, then you have qualified for premium free Part A. Tony, can you post the sheet, the flyer? One moment, please. Okay. So Part A at the top of the flyer. If you have worked in a job that took taxes out of your check and you've paid attention to what those taxes are, you may have seen one of the line items being Medicare. And so that small deduction that came out of your check for Medicare was to cover Part A, your hospital insurance. And so after 10 years of working, you have accumulated the 40 credits to receive premium free Part A of Medicare. You've already paid into it. And then the day comes when you're approaching your 65th birthday, and you have to make a choice about enrolling in Part B. So Part B is the medical insurance. And in short, that just means the part that is paid to the doctor. So Part A covers your hospital, outpatient services, hospice care, and Part B covers the doctor's services as well as some medication that you can only receive in the doctor's office. So that's putting it, that's the real short version of what Part B covers. Now, when I say that you have to make a decision about enrolling into Part B, I say that because for those who plan to work beyond their 65th birthday, you love your job, maybe you just started your job and you think you want to work until you are age 70 or 75, maybe even 80, if you go for it, if you want to work until you're 80. And I had a client that did it that way. You do not have to enroll in Part B necessarily. If you have insurance on the job, so group health insurance, and it is as good as or better than what Medicare will offer you on the medical side and the prescription drug side, then you do not have to enroll in Part B. How do you know that your insurance is as good as Medicare? One of the things that you will want to do when you're 65 is make sure you get a letter from your job that talks about the creditability of your coverage. How good is your coverage? How big is your company? If you work for a very, very small company, I'm talking about under less than 20 people, you will want to enroll in Medicare to avoid the penalties. So I'll talk about the penalties a little bit later. So Part A, hospital insurance, you see what that Part A covers. Each of these has an annual deductible. You see that the Part A deductible is $1,676. Now, that is not what you pay out of your pocket. Again, you've already covered your Part A through your years of working. You've already paid into it, but that deductible is going to be taken care of for you. Okay. And then when you enroll in Part B, you're going to pay that monthly premium of $185. How do you pay that? Well, most people pay their Part B premium every month, either through Social Security deductions because they have already enrolled in Social Security, or if they once upon a time worked for the railroad, that's the other place where the Social Security Administration can deduct from your monthly benefits. Okay, so it's either deducted from your Social Security check or deducted from your railroad retirement check, also known as benefits. If you are not on Social Security, do not receive railroad retirement benefits, then you receive a bill for your Part B premium. And I will tell you this, in the event that you forget to pay your Part B premiums, and I'm talking about forgetting for 3 to 6 months, then they will cancel your coverage. So with Medicare, as long as you maintain your Part B premium payment, you will always have the coverage. It's like if you no longer have a driver's license, you are no longer eligible to drive. If you have stopped paying for your Part B premium of Medicare, you will no longer receive your services. So one of the things that can happen is you have a doctor's appointment, or they might call you in advance and say, I'm sorry, we can't keep your appointment because it looks like your insurance has been canceled. Or you go to the pharmacy, and when you are used to paying $20 or $30, maybe even less, to pick up your monthly prescriptions, you suddenly have to pay $500 for your prescriptions because you are now paying um, uh, the full cost of your medication because your insurance was canceled. And so, yes, so you always want to maintain your Part B payment. Your Part A is already taken care of. Now, in the event that you did not work long enough to pay into Part A, you will either pay $218 or $518 for the cost for your Part A premium. It just depends on how long you worked. If you never worked and are eligible for Medicaid, and of course, in the state of California, we call it Medi-Cal. If you are qualified for Medi-Cal because you qualify based on low income, the state of California will cover your Part A and Part B premiums. Covering Part A is new in 2025. Okay. And so again, if you qualify for Medi-Cal, the state of California will cover your Part A and your Part B if your income is very low. All right. So I want to stay on target. I want to follow this and then let everybody jump in with their questions, because there is some information that I left out, but just for the interest of time, I'm going to follow the flyer here. So what is Part C? Part C is also known as Medicare Advantage, and Medicare Advantage plans are HMO plans as well as PPO plans. The big difference between original Medicare, which is Part A and Part B, so original Medicare is Part A and Part B. Medicare Advantage is Part C. The big difference is Medicare Advantage offers you a host of benefits that A and B do not offer you, okay? Original Medicare will cost you 20%. The health plan itself, original Medicare, and that's again Part A and Part B, for your hospital coverage, your hospital cost and your doctor's costs, will only cover that. Whereas Medicare Advantage rolls everything into one, A and B, and also includes dental, vision, hearing, transportation, your prescription drug plan, chiropractic services, acupuncture services, meals if you qualify for meals, a monthly or a quarterly benefit where you can go into a pharmacy and buy things that are not from the pharmacist. So again, Part C offers you a larger host of benefits than A and B, which is original Medicare. Moving right on, Part D, the prescription drug plan. If you enroll in only Part A and B, you have to get what's called a standalone prescription drug plan, and that's Part D. And so many carriers, some that you might be familiar with because you're very likely, your group plan at work is very likely one of the top Medicare plans. Okay, they have medical plans and they have prescription drug plans. So again, if you only have A and B, you have to go get a separate Part D plan. Why do you have to do that? Because there is a penalty if you don't get it. Well, I'm not sick. I don't take medication. You are still required to have a separate Part D or prescription drug plan. And for this year, 2025, they have started to add a deductible to the prescription drug plans. And for this year, it's on most of the plans, it's $590. And the true out of pocket is $2,000. And I'll explain that a little bit later, what that true out of pocket is, what that true out of pocket means. So again, if you have Part A and Part B, you have to couple that with Part D. If you have Part C, then everything is rolled into one. And everything that's rolled into Part C is A, B, and D. and everything has a separate cost or no cost at all. Depending on the Medicare Advantage plan you have, there's many Medicare Advantage plans that have no monthly premium. And so you'll talk to people that say, did you pay for your hospitalization? Did you pay for that surgery? What did you pay for? And they'll say, nothing. I had a whole heart attack and I didn't have to pay for anything because part of it has already been covered. Let's move right along to the Medicare supplement, also known as Medigap plans. You may have heard someone say, well, I have a Medicare supplement plan or a true PPO. And that's what a Medicare supplement plan is. You may have heard someone say, well, I have Medicare supplement A or N or G or C or F. Those are plans that have a much broader network. You don't have to have a doctor's referral. You choose any doctor that you want to see in the country, as long as the doctor takes Medicare, has a contract. So doctors and hospitals have contracts with Medicare. And so as long as that doctor that you want to see has a Medicare contract, and they agree to the rates that Medicare pays them. That's what doctors do. They agree to the rates that Medicare pays them, and that's why they are a participating primary care doctor or a specialist. They accept those rates, and you can go see any doctor that you want to see. And you don't even have to choose a primary care doctor. In a Medicare Advantage plan, you have to choose a primary care doctor. They are generally HMOs. There are a few PPOs in Medicare Advantage coverage, but if you have an HMO, you have to choose a primary care doctor. That doctor directs all of your care, and they direct your care by issuing authorizations, otherwise known as referrals, to a specialist if you need to see a specialist. So that's how the HMOs work. Whereas if you have a Medicare supplement plan, you're going to pay a higher rate. If you get into a Medicare supplement plan, right as you're turning 65, you will pay the lowest amount monthly premium for the supplement that you choose. Okay, and I say you will pay the lowest amount because it goes up with age. Depending on the company that you're with, your Medicare supplement will likely go up once, possibly twice in a year. It's going to increase on your birthday, and it's going to increase due to utilization and the management of that particular supplement that you've chosen. So the rates will go up. On some companies, they have very few increases on the supplement simply because utilization is low, and sometimes it's zip code driven. And they find that, well, the utilization is so low, people aren't getting very, very ill. So we're going to keep the rates low for possibly another year. But you'll always be notified if your rate is going to go up. And also, when you have a Medicare supplement plan, you have to get a separate prescription drug plan because your prescription drug plan is not built into that Medicare supplement plan like it is with a Medicare Advantage plan. Okay, so when you have a Medicare supplement plan, you have to pay your Part B premium, you have to pay the premium for the Medicare supplement, and then you have to pay the premium for your prescription drug plan. So there's a range of rates depending on the Medicare supplement plan that you get, depending on the company that you go with, depending on the prescription drug plan that you choose. If you go into Medicare at 65 and you choose a Medicare supplement plan, there will be no underwriting. So what is underwriting? Underwriting is where you have to fill out an application, tell them all about your health history, and then they give you a yes or no answer. That's underwriting. If you get into a Medicare supplement plan right when you're turning 65, there's no underwriting. And that's the best time to get in. If you try to get into it a year later, the rates have already gone up, and there's a possibility that you've had a diagnosis of something, and it's very possible that that diagnosis will cause you to get a no answer to get into the Medicare supplement plan, because really they're looking for very, very healthy people to enroll in Medicare supplement plans. But if you know that you have diabetes, heart disease, you will likely get a no if you enroll after you've turned 65. So the best time to get into a Medicare supplement plan is right when you're turning 65. They do not question your health at that time. I want to talk about something that's not so nice, and that's the penalties of late enrollment. So Part A, Part B, and Part D. So A, hospitalization, B, medical insurance, and D, your prescription drug coverage. There is a penalty for late enrollment in each of those. So on Part A, there is a 10% penalty if you enroll too late. Okay. And too late is when you were first eligible. When am I first eligible? You're first eligible 3 months before your birthday, the month of your birthday, and 3 months after your birthday. So everybody gets a 7-month window to enroll in Part A. Okay. Same with Part B, 7-month window, 3 months before your birthday, the month of your birthday, and 3 months after. That's it. If you delay that without an exception, and the exception is because you were working, and so you already had good coverage at your job. If you wait until after that 7-month window, now the clock starts ticking. It looks like you are going to be penalized. And the longer you wait, the higher the penalty. There is also a penalty for Part D. Now, it's not quite as high. With Part D, again, that's your prescription drug plan, the penalty is 1% per month. Okay, so you can stop that really soon. Okay, say you wait a month, say you wait 2 months. Now you've got your Part D, your prescription drug plan all enrolled in everything. CMS, the Center for Medicaid and Medicare Services, know that you have enrolled, and they've stopped the penalty. No one wants any penalties for anything ever, because it's always a bad thing. So you want to really start thinking about your Medicare journey early on. Certainly if you are, 4 months out, 5 months out, a year out, whatever the case is, start thinking about it as soon as you can, so that you'll know that you've got some options. You have time to look into plans. And I'll tell you another thing. As you get closer to your 65th birthday, you are going to be inundated with mail from all the carriers, and they're just competing for your business. And so when you get that mail from Anthem Blue Cross or Blue Shield of California or Humana or SCAN or Aetna or Cigna, whatever the case is, it's just advertisement. It's just advertisement. They're just competing for your business. Whatever you do, don't call them and give them your information unless you're ready to enroll. Now, how do you truly enroll in Medicare? You start with going to the Social Security Administration, so ssa.gov. Okay, that's the website, Social Security Administration.gov, but ssa.gov. You go there and you're going to look around. Certainly, if you've never been on the website before, it's a little bit confusing, but you want to zero in on, enroll in Medicare. And so you're going to click there. And then it's going to ask you, do you already have a My Social Security account? So you have to enroll in you have to open a My Social Security account. Okay. And then so that opening that My Social Security account um, uh, helps you get to the Medicare enrollment. And and then if you enter everything right, it's not a long process. I promise you, it's not a long process to enroll in that. As long as the website is operating properly, and you do it, try to do it early in the day, okay? Because it's supposed to stay open until 7 p.m. Pacific Standard Time. So our time. Marilyn, I know that you're in Texas, and I'm not sure what your time zone is. Are you Pacific, Marilyn?
Central.
Oh, you're Central. Okay. So I see that a lot of people on here are Pacific Standard Time. And so you just want to get on the website early, because otherwise it won't let you in after a certain time. And so you will want to pay attention to this, to the time that you're enrolling, because it may not let you in. And again, I'm happy to help everybody enroll in it, because it can be confusing. You want to take a lot of notes. You want to write down your passwords and whatnot when you first go on there, so that just to make it easy on yourself. But so that's Medicare basics. There's so much more for you to learn, but those are the basics. As I know that some of you on here are approaching your 65th birthday, and you want to be armed with as much information about it as you can, so that you don't fall for any misinformation that someone gives you. When you do enroll in Medicare, you're going to receive a book from the Social Security Administration called Medicare and You. And if you're enrolling in Medicare in 2025, you will receive the book this year after your enrollment. And it's more information than you probably ever wanted to know, but it's good information to have on hand in case you ever want to know anything. And you can't call them, you're on hold for 2 hours. You can't go into the office without an appointment. So that book, Medicare and You, is very useful, and you want to keep it handy when you have it at home. It is a good resource. It is a good resource, and just something that you want to keep around. Okay. And so you know what? So that is the end of my presentation, to let you know what the basics are. And I am now open to taking questions.
You know me, I gotta ask a question. So during the
Sure.
presentation, you mentioned the 7 month window,
Hmm.
right? So you got a person, they're working, they're working, they decide they're not going to retire from their job until they're 65, 68, right? How long after your official retirement date are you required to apply for Medicare?
You have an 8-month window. You have an 8-month window after you have, I'm sorry, I didn't mean that. 63 days.
63 days.
63 days. Yes. Uh-huh.
Okay, and that's regardless of your birthday or anything. After your official retirement date.
Yes.
Okay.
Because once you no longer have that group health plan as your insurance, okay, so that you don't have any coverage, you're 65, so you can't go on Covered California, because Covered California won't allow you to enroll because you're 65. Okay, because everything is, birthday driven, zip code driven. But
Mm-hmm.
certainly Covered California says, hey, you're 65, you're eligible for Medicare, so you have to go over there. And so again, you are the clock starts ticking. You're starting to get into the penalty zone, and you want to avoid that.
Okay, awesome. So
Mhm.
Miss Antoinette Martin, she asked, what is the cost of Medicare Advantage?
So the cost of Medicare Advantage is the cost of your Part B premium. So you've got your Part B premium of $185. That's your ticket in. The Part B premium of $185 is your ticket into Medicare. And then you have you've got all these other options. You've got Medicare Advantage, and there's a host of zero premium plans on Medicare Advantage. There's a host. Every company, pretty much every company that you can think of, certainly in the zip code that you're in, Tony, Antoinette Martin, the zip code that you're in, there's 100. I'm going to say 150. I think I have that number wrong, but you've got about 150 plans to choose from, mostly at zero premium, zero monthly premium. So what are you paying for? All you're paying for is to maintain your Part B premium of $185. And then you, if you have any medication, then I have to check, the plan that you choose, I have to see what's in the formulary. Is your current medication in the formulary? And that's just the long list of medications that they offer to you. And then the medication is tiered. Tier 1. On some plans, it might go up to tier 6, mostly up to tier 5. That's your specialty medications, your cancer medications and whatnot.
Mm-hmm.
And so, but if you're on real simple medication, a lot of blood pressure medications are on tier 1 and there's zero. So what are you paying for? You're paying $185 a month, but to go to the doctor, zero. To go see your specialist, zero. To get your diagnostic tests, your lab work, zero. And so on a lot of those plans, you'll see just a host of zeros, 0, 0, 0, 0, 0, 0. And all of the Medicare Advantage plans, if you look at them side by side, you go like, what's the difference? And so, first of all, you won't see a lot of differences on the core benefits. The core benefits, your hospitalizations, your doctor services, the types of doctors that you see, your your diagnostics, your lab works, your preventive services. Your preventive services will always be zero. And there's a huge long list of preventive services, some that you may not even ever need to get, but they're there. And but the big difference is the ancillary services, the extra benefits, that original Medicare A and B don't offer you. So A and B will never offer you dental, vision, hearing, acupuncture, chiropractic services,
Mm-hmm.
a card to go into the pharmacy and buy, toothpaste, vitamin supplements, a wrist guard. A lot of the plans give you extras like that. Many of the plans have transportation benefits, certainly in Southern California. If you live in Northern California or way out in Imperial Valley, there's no transportation, but most of the other local plans in Southern California, in LA County, excuse me, offer transportation benefits. And so which means that you are allowed to call up 2 days in advance and say, hey, I need a ride to the doctor and I need a ride back home, or I need a ride to the pharmacy, or I need a ride to the chiropractor or to the acupuncturist. So that's no cost to you. So again, those are some of the services that original Medicare A and B don't offer you. A lot of the health plans, again, Anthem, Blue Cross, Blue Shield of California, SCAN, Aetna, who am I forgetting? Humana, many, many others. It's how they compete with each other. Okay, dental. Some of these plans have $3,000 in dental benefits. Some of them have less. Many of the plans, many of the carriers offer benefits, specialized plans to people who have chronic conditions. So they even get additional benefits. So, but again, zero. A lot of Medicare Advantage plans cost you nothing every month.
Excellent, excellent.
Mm-hmm.
I have some questions,
So
but
I do have a question.
there we go.
Go ahead, Baron.
So I use the VA. I use the VA 100%. I get all my prescriptions and everything else I want. Still have to enroll?
No, Baron, because you've been using it at 100%. It's the VA, your VA benefits. I know that that's hospitalization and your services from your doctor. Again, the Medicare Advantage plans are going to offer you benefits that the VA doesn't offer. And it's a Medicare Advantage plan
That's
is
it.
a good backup because I don't know if you have a long wait over there. Um, you can't see the doctor that you want to see, so you go into a Medicare Advantage plan and you get to pick a doctor. Maybe you already know a doctor. Maybe some of those doctors over there have a practice and you can see them outside of the VA. And again, the additional benefits,
I see.
and you can do that at no cost or receive those additional benefits at no cost to you.
All right.
So
I'm a
it's
veteran
just
as
it's
well.
just something to consider.
I'm a veteran as well. Pastor Bowie is a veteran. You're saying that Medicare is offering different features than what they offer at the VA if you're at 100%. What about if you're less than 100%? You know?
So if you've got VA or if you have your VA benefits, okay, you can get something else. TRICARE is a little different. And I have to tell you that I'm not 100% on TRICARE, Baron. Wait, Baron, are you VA or TRICARE? Because I know that
TRICARE.
TRICARE is for life.
Right.
Mm-hmm. And
I
so,
TRICARE.
yeah. I'm sorry, Baron, are you VA or TRICARE?
TRICARE.
Your TRICARE. Okay. So you got something else to consider that's different than someone who's just VA. So we'll have to talk about that offline.
Okay.
Awesome.
Uh-huh.
Yeah, I give you a little insight.
Okay.
Of course, you are a veteran. You don't necessarily get all of the
Benefits.
advantages. If you're
Right.
100%, then you get dental and other things are added, but you have to be 100% disabled. If you're
Mm-hmm.
40 or less, you don't get all of the benefits of someone who is rated at 100%.
Mm-hmm.
So that's where it sounds like the Advantage program would probably come into play. And not only that, it appears that the Advantage program offers quite a few uh, additional benefits, like you talk about transportation. Those things are very important. And also, if it's a $3,000 dental, that's a big benefit annually. And to pay $185 a month for what you get, sometimes depending on where you are financially, the $185 is worth to probably go on an Advantage program with your VA as well. Yeah.
Mm-hmm. And see, and don't forget, a lot of veterans are on Medi-Cal, and
Yeah.
so they if they're on Medi-Cal, so
Yeah.
they're at zero paying for anything.
Right.
So the state is covering their A and B. The VA is certainly covering their prescription drugs. I have clients that
Right.
only use their VA for their prescription drugs because the formulary is huge. It's just huge. So they're like, oh, don't worry about that. They take care of every single prescription known to
Right. There's
man.
no deductible or no copay.
Right.
Yes.
Yeah.
So that
No,
that
no,
is
no,
one of the
no.
big advantages. Yeah.
Yeah. And you strategize that way. It's like, why would I want to pay a deductible over here when I can exercise my VA benefits and get it with no deductible?
Yes. Yes.
Mm-hmm.
Exactly. Yes, yes.
Mm-hmm. And so you use all the benefits at your disposal, to just strategize with it. And you want to limit your out-of-pocket costs as much as possible. For those that don't have to worry about their out-of-pocket costs and they want a lot of flexibility, a lot of options, then those are the ones that choose a Medicare supplement plan because they have more disposable income. They can afford 3 premiums every month versus 1 premium. Okay, so if you have a Medicare supplement, you always have your Part B premium of 185, and then you have your premium for the plan itself. I'm going to do what I'm not supposed to do. Blue Shield of California, Plan G. Okay, it's a Medicare supplement plan, and it's a great one. It's one of the best. Okay, Medicare supplement plans, and so you would have a premium for your Plan G, and then you have that additional premium for your prescription drugs. So Medicare supplement, 3 premiums. Medicare Advantage, 1 premium. So it depends on what does your income look like at 65? Are you already retired? Are you already on Social Security? Do you have an additional stream of income coming, from somewhere? So not just Social Security. Do you have a pension somewhere? Do you have a 401k that you're starting to withdraw from? It depends. It's just part of your Medicare journey, your retirement journey, whatever you want to call it. You have to look at everything all together. Don't leave out your health care when you're talking about retirement. It's a big consideration.
Yes. Yeah, everything's not equal is what you're saying, depending on your financial situation and also
Absolutely.
depending on your health.
Absolutely.
If you're good health, that plays a major role as well.
Absolutely. And as I mentioned, there's Medicare Advantage plans specifically for those that have Medicare and Medicaid. So in California, Medi-Cal. So those are called DSNPs, dual special needs plans. And then for the people that have a chronic condition, there's chronic special needs plans. There's even special needs plans for people that are institutionalized, meaning in a skilled nursing facility or in a long-term care facility. There's plans for them. So it just depends on what is your situation, what is your level of health. There's even the PACE program, and that's not even mentioned here because we call PACE Part E of Medicare. PACE means the Program for All-Inclusive Care of the Elderly. And what PACE is, it's operated by the state of California. And so it is for individuals who have Medicare and Medi-Cal together. And it's the person that gets enrolled in a PACE program is the person that's almost needs to be in a skilled nursing facility or long-term care, almost, but they still have some independence. They still live at home. They still do all of their own activities of daily living. So they're dressing themselves, they're bathing and showering themselves, they're cooking for themselves, they're driving, they're able to clean up their home. But they're likely on a walker. They might even be in a wheelchair. They might even have a caregiver, but they're just under the level of care before you go into a skilled nursing facility. So the PACE programs, there's many of them all around. They invite you to a place, their facilities. They give you transportation to your doctor's appointments. They might even see their doctor might even be at their facilities because a lot of PACE programs have a clinic inside the facility. And so you see your primary care doctor, you see your vision, your optometrist or your ophthalmologist, you see your dentist there, you see your audiologist there, you have your physical therapy there, you eat meals there, you socialize there, because socialization is a key to improvement of your health. A lot of people don't improve at a decent pace because they lack socialization in their lives. So they're at home, they're by themselves, they might have contact with a family member or someone periodically, but more socialization is a key to improvement. It's called a social determinant of health. And so it's one of the things that helps people. And so that's the PACE program. So someone that's they're all around. They're here in Pasadena, Northern California, way out in Riverside County. They're all over the place, and it's a great place to be for someone that doesn't need to be in a skilled nursing facility, but almost, because you have to go back home at the end of the day. They're not residential, so it's a consideration for those that are really ill and on Medi-Cal.
If I can jump in
Any
there,
questions?
Miss Mariana Bravo, she has a question.
Go ahead, Alejandra.
She's on
I know her
mute.
as Alejandra, so
No, I wanted to ask which of the plans offers hospice care, or is that another type of supplement somewhere
so
else?
hospice is a paid for benefit on Part A. So none of the health plans will ever offer hospice because hospice is included in your Part A coverage.
Mhm. I didn't know that.
Sure.
Okay.
Any other questions?
I got some. I was just trying to get everybody else's in there as soon as possible. For us, uneducated
Mhm.
Medicare people, what is the difference between Medicare and long-term care?
So Medicare is again the federal program for those 65 and over,
Mhm.
okay? And then long-term care is what you have to buy long-term care.
Mm.
Okay, you've got to go through underwriting for long-term care. Um, different companies offer it. It's offered through life insurance companies.
Mhm.
And long-term care, somebody 35 years old would have a hard time qualifying for long-term care because they simply don't want to sell it to somebody that age unless they're very, very ill.
Mhm.
Okay. And so ideally they want somebody who's, in their 50s, makes has an income of a certain level, and ideally you are in great health, because then there's the underwriting. They may or may not approve you for it. The longer you wait, which is the weird thing about it, they don't want anybody really young. They want people of a certain, age level and income level,
Mhm.
but also you don't want to wait until you're 60 years old, certainly not 65 years old, to go into a long-term care plan, because it could cost you, $400 a month. But with long-term care plans, when you have one, when you choose one, you choose it based on, okay, I want to receive, um, I'm going to pay into it up to a certain amount because I want to receive $3,000 a month. I
Mhm.
think $3,000 a month will help me. It will help me pay my caregiver, um, pay my caregiver, uh, buy my medication if my medication is costly. Um, I looks like I'm going to need two caregivers a month, or
Mhm.
or a week, or per day. So depending on what you're paying your caregiver, and maybe you have a high dollar medication that you're paying 33% of the cost for, and you're not in a patient assistance program. You can't find anyone to help you pay for that medication, but that monthly benefit that you get from your long-term care plan um, will help you pay for all of that. So you have to look at what it is you want to pay for, how much you think your need will be, and with the long-term care plan, it is recommended that you build in the cost of inflation. So don't just say, okay, I want $3,000 a month every year. What is that? $36,000 a year.
Mhm.
It's actually going to be more than that
Yeah.
because you have to build in inflation because they're always going to go up. They're always going to increase in price. And so it's one of the things you have to look at how often you want the benefit, what inflation is going to look like, um, and what you're going to be paying for.
Excellent.
Yeah.
Did you want to
It's
jump in there,
very,
Miss
long-term care is
Bravo?
very involved.
Or I keep calling her, but she said, is that, I guess that's not her actual name.
No, no, that's my daughter. I'm using her computer.
Got it.
I wanted to ask, how can we get or where can one get the Medicare and You booklet, Reagan?
So once you get now with the Social Security offices, if you go on there on the right day, you'll see against the wall a stack of the books if they have them sitting out. If you ask nicely, a nice person will go on the back and get you a book. Okay. If you catch them at the right time. But you know, they're pretty stressed out right now. And so really and they will mail you one, excuse me. They will mail you one once you enroll in Medicare.
Mhm. Excellent.
Yeah,
I
so
had
you'll get one free in the mail, Alejandro.
I have two things I wanted to do. I got to put somebody on the spot, but I'm gonna hold that for a second because I got to get clarification on something that you shared during the presentation. So,
Mhm.
you're 64 and 3/4. It's time for you. You said 3 months before your birthday, during your birthday, 3 months after your birthday. As long as you do it within that window, you don't get a medical exam. Is that what I understood?
So you're mixing two things. Okay, before as you're approaching your 65th birthday, you have a 7-month window to enroll in Medicare. That's just your 7-month window to get your A and B, your little red, white, and blue card. Maybe you've seen your parents' card, just
Hmm.
to get the red, white, and blue card that has your 11 alphanumeric code in the middle, your number, your Medicare beneficiary number, and then it's going to say on there the dates that your part A and your part B were effective, and your A and B will always be effective the month of your birthday. Now, if you get if you go into A and B during the general enrollment period, which is in January, then it's not going to have your birth
Oh,
month on the card. Because if your birthday was in November, but you didn't sign up until January, then it's not going to match your birthday. So that's just something to know. But generally, your red, white, and blue card has the month of your birthday on it for A and B. It's always going to start on the first of the month. Even if your birthday is the 25th of the month, your red, white, and blue card will always be the first of the month.
got it.
Okay, so you can start using it long before your birthday is my point. You can start using it long before your birthday. And then Tony, you mentioned the medical exam. Okay, so you will only have a medical exam if you're applying for a Medicare supplement plan after your 65th birthday. And then 6 to 7 months after that. If
Got
you
it.
so if you wait until you're 65 and 65 and 7 months, you will go into underwriting with your application.
All right.
Because they're giving you an opportunity to do everything in advance, and no underwriting is a plus.
Right.
It is an automatic, it's a guaranteed, it's called a guaranteed enrollment, guaranteed acceptance.
Excellent. So,
Mhm.
as we're approaching the top of the hour, I wanted to make sure everybody got a chance to gather Miss Reagan's contact information because I'm certain everyone's going to have additional questions. And while you're jotting that down, I wanted to put someone on the spot real quick. There's a couple of people online right now. One of my agents out of Houston, Miss Linda Kenyon, and also Pastor Oliver Bowie. Um, Reagan and I, we've been working together. She's actually the person that handles any of my Medicare clients because I don't know how to do that. So she covers that, and
Right.
I look out for her taking care of her life insurance questions, and it's
Okay.
been a fantastic partnership. And so that, collaboration has been been an asset for her and I. And I got a chance to meet Pastor Oliver Bowie during a social justice gathering, and in our communications, he invited me out to his church to participate in some financial literacy courses spanning a period of 6 weeks, possibly more. And we've only met 2 weeks so far, but in that 2 weeks, we've already had double-digit growth with a lot of people really appreciating the information. So, with God's permission and Pastor Bowie's permission, I wanted to put him on the spot and, give him a quick 30 to 90 seconds to plug in his God, Money, and Me financial literacy program at his church here in Los Angeles. Pastor Bowie, would you mind sharing a few comments?
Yes, I'd just like to say, one, thank you, Tony, for your kindness and generosity. And Ms. Reagan, I want to thank you for the knowledge
Thank
and
you, Pastor Bowie.
information that you have shared. Before it's all over, I'll plan to probably connect with you as well and see if I can open some doors for you to be able to give your presentation.
Thank you. I
One of the
appreciate that.
things that I've discovered is that, unfortunately, with so many of us, and especially our people, when it comes to finances, we just lack knowledge. It's not that we're dumb or anything, we just don't know. So I believe that ministry should approach a life from a holistic standpoint, deal with the whole person. And so, with that saying, I have been fortunate enough to have and present an opportunity open to the community, not to the church, where we have right now, we've just got a schedule for 6 weeks, but that's what we give the public. We plan for it to go on further than that, where you're able to come in and join us. I'm at Bellevue Community United Presbyterian Church, which is located at 675 East 118th Street. If you need this information, Tony, feel free to give it to them. This is in the city of Los Angeles. So we're going into our third week, but you're welcome to come in. And we approach this financial literacy not from what you usually get, the norm, but actually from a practical standpoint with real life scenarios, dealing with real life issues, where we're able to present information to the people that attend. And then also they have the opportunity to ask questions. Um, and we plan to give them knowledge which will help them become economically empowered and also to get on the road to begin to look to leave a financial legacy for their family.
Amen.
And there's no one too young and no one too old. And I'm sure if any of you want to come out, we meet on Thursday, starts at 6 p.m., and we start on time. I'm going to tell you, it's no seat time. We start at 6 and we end at 7:30. It's an hour and a half. I believe that we've had a wonderful time for the past couple of weeks. I'm certain we're going to have a wonderful time today, and we will deal with real life situations, and you get the opportunity to ask questions. And I'm sure that if you come, that you will learn something and you will be better off and more knowledgeable financially, literally, and you will be able to be more empowered. And so I just like to extend that to you, Tony. Thank you so much. And so right now we're in the third week. It's not too late to start. Come in. I'm sure that you'll be able to receive something.
Amen,
Very
Pastor.
good. Thank you.
Amen.
Thank you.
I'm not done yet. I still got 39 seconds before the end of this hour. So, y'all know I'm really good at putting people on the spot. Yes, Reagan.
I just wanted to add something
Okay.
that last Thursday, I just returned from the annual conference about all things Medicare. And what I just wanted to share with everybody is, of all the things that we talked about during the conference, we touched on politics just a little bit.
Mm-hmm.
We were hoping that we would get more information on the national level. So this the National Association of Business Insurance Professionals, where they lobby in Washington. They go up there, they confront, they find out what's going on, what's coming down the pipe for Medicare and through CMS, what's going to be the final rule on anything, what's happening with Social Security, what's happening with Medicare, what's happening with Medicaid, because that's the big ticket that's on the table, the $880 billion that they're trying to touch on. So unfortunately, I know that a lot of people have that on their mind. What's happening with Medicare? What's going to happen? Are they taking it away? What's happening with Medicaid? Are they going to take it away? We simply don't know.
Right.
We simply, we don't know how much is going to be impacted this year, if anything at all. But, you know, it's in the news all the time, but we just don't know. So everything is called a final rule. We did not, unfortunately, receive any final rules. The next time that we could potentially find out anything from NABIP will be just before the annual enrollment period, which begins in October. And so right before then, we will find out a lot more information. So anybody, you know, going into Medicare at that time will get fresh information. And plus everybody's watching the news. But in terms of guiding somebody on it, that it'll be in October when we most likely get the final information that will be useful to people in October.
Well, I'm sure you can appreciate that no good deed goes unpunished. So because you just opened the door with that nice little nugget, we are going to expect you to come back and do a presentation explaining some of the new changes. So we look forward to
Oh,
seeing you just
absolutely. I wish I
before.
had the president here with me, not President Trump, but the president of our
We
organization.
understand.
Yeah.
And if I can, if
And
you'll allow me
so,
a couple more minutes, you know, no good idea it belongs to you, right? A good idea belongs to everyone. It belongs to the community. And some of the things that Pastor Bowie has taught me over the past couple of weeks, I've been sharing with my leaders out in Houston. So I invited Linda Kenyon on to be able to participate in this presentation. And I just wanted the opportunity to present her to all of you because she's going to be, you know, sharing some of what we've learned here as well as what we've learned at Pastor Bowie's church out there in Houston, to be able to expand this community and expand this discussion to other states. So let me put Miss Linda Kenyon on the spot. Say hi, Miss Linda Kenyon.
Hello, everyone.
hi, Linda.
Hello.
What are you wanting me to do exactly?
I just want you to say hi. Let everybody know who you are.
Oh, okay. Well, I guess I started a group of people here in Houston because our headquarters are in California, where Tony is. And so Tony is the one who brought me in to this organization that we're all a part of. And so we've grown a group here. And so we are spreading information in whatever form we need to. Tony's taken on this format where we want to be well-rounded. So we want information that's going to come from more than just insurance. I have my grandkids here. I don't know if y'all can hear all this.
Well, we see him. Well-dressed man. Well-dressed man.
I'm trying to focus. And so it's been going really well. And so Pastor Bowie, you know, I really like what you're doing because pastors tend to have to deal a lot with passing the hat, you know, when it comes to insurance, if that policy is not in place. So we definitely want to get the word out as to that option in regards to insurance. And of course, all the supporting information is really good. So Medicare and the other guests we've had on, this is really good. And that's all I have to say at this time.
Well, thank you so much, Miss
Thank
Linda
you, Ms.
Kenyon.
Kenneth.
You're the best.
Thank you, Linda.
Thank you so
Thank
much.
you.
Thank you so much, Ragan, for your outstanding presentation. Thank you so much to all the guests, Pastor
Yes,
Bowie,
thank you.
Miss Martin and Demetria,
Thank
Mr.
Thank
Bennett
all of you.
Burns, Miss Gamble, Miss Blannon, the mother of Miss Mariana Bravo. I don't know what your name is, but thank you so much for being on. I really appreciate y'all for coming out. We do this every week, every week, the same bat time, same bat channel. I'm looking forward to this continuing to expand. I'm looking forward to continued collaboration with Reagan as well as Pastor Bowie and Linda out there in Houston, Texas. If you have any questions, comments, or concerns, please share that with the people that invited you to this call. If there is a particular topic that you're interested in us covering, please share it with us, because there's quite a few people on this line right now who are experts in their particular field. One of the things that I'm hoping to do is to be able to continue bringing experts on, because even though I'm knowledgeable in many different financial industries, I am licensed as a life producer. So Reagan, she's licensed as a Medicare professional, and we've had tax professionals, credit professionals, doctors, attorneys, even district attorneys come on this line. So I want you to be able to get the information from people who are professionals in their field, so you can be confident that the information that's being shared with you is information that's pretty solid. So with that, I thank you so much again. I look forward to seeing you all next week. Take care now.
Thank you,
Thank you,
Tony.
everybody.
And thank you, Mrs. Reagan.
Okay, you're welcome.